All right, so we're going to get started. Wow, for a morning person, the end of the day is quite a challenge. Does anyone want to stretch? Yeah. Here we go. Yay! Okay, so welcome. I'm Bonnie Feldman, affectionately known as Dr. Bonnie 360, a provider, digital health analyst, and business development consultant. Like many of you, I am sometimes a patient. So for today, I'm delighted to bring you this panel, which is called Community Platforms and Data, How to Engage Patients Using Data, Social Media, and Games. I have three distinguished panelists known for their forward-looking thinking in this arena. First, we have Dan Conroy, the head of business development at Aetna CarePass. Second, we have Anmol Madan, the CEO and co-founder of Ginger.io. And third, we have Bruce Springer, the CEO and president of One Health. This is an amazing panel. Let me give you some idea of how we're going to structure it. Each of us is going to talk briefly and quickly for 5 minutes. There's 40 minutes total, which leaves 20 minutes for your questions. So we're hoping you're going to have a lot of questions. Have you ever woken up in the middle of the night with a burst of creativity? This panel came to me as one of those middle-of-the-night bursts. After practicing dentistry and then working all over Wall Street, in my first research journey in mobile health, I got to look at lots of fun dashboards and apps using mobile apps and gaming mechanics with online social networks to nudge individual behavior change. But like many of you, I got excited about what was behind the curtain or under the hood. And I got hooked on how data is collected, analyzed, managed, and applied by users. My aha moment in my research journey is when I discovered this evolving ecosystem of experimenters ranging from health and wellness to chronic disease. After interviewing 125 companies and attending more than 25 of these types of meetings, I have concluded that mobile and 24/7 access is very powerful in 3 ways. It can help us help ourselves, it can leverage the expertise of one-to-many, and extend the reach of our healers. Think about it. If healers is defined broadly and we can use these tools, then we can help many more people. Today, we will explore how pioneering companies such as Aetna CarePass, Ginger.io, and One Health are taking advantage of increasing power of computational sensors and data analytics to create and use health data in new and different ways. One of these new ways is social media. And as we all know, in the wake of the NSA revelations, metadata includes tracking time and place. But in healthcare, unlike in spying, we can have positive peer-to-peer support networks that help us help ourselves. These online social networks offer fluidity and flexibility not seen in the offline world. We can assemble and disassemble these networks depending upon personal preferences and needs at any time. We can personalize them, once again, helping us to help ourselves. Social media data is giving us new types of data streams. These might include behavioral data or lifestyle data or patient self-reported data. Metadata comes in here too with tracking data. But once again, life is not a one-size-fits-all. We need personalized solutions. And perhaps, as we will hear from our panelists, mixing and matching of these tools is part of the answer. As you can see in this simplified visual, there are many sources of data coming into our system. For the purposes of this presentation, we will focus on smartphones and social media, where Aetna CarePass is accumulating fitness data and One Health and Ginger.io are accumulating real-time behavioral data. Who is using this data and how? Interestingly, the big sources of users are also the big users of data. For the purposes of this discussion, we're going to focus on the patients, the providers, the employers, and the insurers. We just heard a lot about feedback loops, and this has been a very interesting conversation to me. As a practicing dentist and as a research analyst, I tried to understand what exactly might a feedback loop be. How could we use data to nudge behavior change? Is an individual feedback loop, or now that we've heard maybe it should be double looped, something like how I interact with my Shine? I engage with the mobile tool, data is created, and feedback is given to me. But these feedback loops can be more powerful when you think about how they might be applied on a population level. And we will hear about some of those ideas from our panelists. The ultimate goal of feedback loops and behavior change is to get us all engaged in how we can help ourselves. Engagement has been a popular topic of late, with Hims writing a book on the subject, other people doing a lot of blog posts. Health Affairs, which is a journal, devoted the entire February issue to the topic of engagement. But what's been curious to me as both a provider and a scientist is no one can actually agree on what engagement is. But wait, our panelists will help us discover the answers. On the dashboard, they will share with us how they think about engagement and behavior change using active and passive data collection, elements of gaming mechanics, and online social network techniques. Under the hood or behind the curtain, they will tell us how they think about creating data and how they use it now and in the future. I have lots of burning questions, so I hope you will too. This is who I am. Here's a few of my questions that are coming up to spur your discussion. And next, we'll turn it over to Dan.
Great. Thank you, Bonnie. So, very excited to be here on the panel with innovative companies like Ginger.io and One Medical. Aetna is really trying to do things differently and realizing that the system is broken and we have a very significant role to play in trying to reshape it. So CarePass started about 2 years ago, and we just released a consumer experience this past June that I'm going to talk about. But at its essence is the catalyst has really been our CEO, Mark Bertolini, and his real emphasis on trying to simplify and make healthcare more convenient for consumers. The smartphone radically changes the game as to how businesses can interact with consumers. We're all familiar with that now. And so for Aetna, this is a little bit of a different leap into how do we position the company in a more consumer-oriented way. And so the product that came out initially in June, and we're continuing to refine as always based on feedback, is really focused on choice. So with a simple interface allowing you to choose different applications that you can engage in to meet your health goals, and also learning more about yourself along the way. And so from a data perspective, the platform is one of aggregation and normalization across several different categories, but the experience for the user is really around discovery about yourself based on that information, and discovering of other challenges or applications that can push you towards that healthier version of yourself. And so the journey, as we like to describe it, is incredibly fragmented for a consumer when you think about the healthcare system, whether it's for yourself as a patient or as a caretaker for a parent or a child. And so when we looked at the system, we tried to narrow it down, focusing on mobile health solutions that are out there. The first application we brought into CarePass, iTriage, is a little bit of an anomaly in the sense that we acquired them late in 2011. But the other applications, this is not meant to be a roll-up. The other applications, that are part of the platform are really already existing. Consumers have voted to use them, and they provide a rich experience. And so for us, what Aetna brings to the table is your personal health data. If you're an Aetna member, part of the beauty of the platform is being able to see your personal health information alongside the information from the applications. And if you're not an Aetna member, you can still sign up for CarePass. You can still have a rich experience. It still offers you the ability to import that type of information ultimately, but we can't provide that for you, obviously. And so from a monitoring perspective, companies like Withings, on the exercise side, several activity tracking type of applications, Active Networks, Runkeeper, et cetera. On the sleep side, we've really focused on devices to date. There are many applications that leverage the smartphone, but we've focused on devices. We found that data to be richer. And then when it comes to nutrition, offering some choice between traditional food log, calorie counter types of applications like a Lose It, and services that grade the food to try and make it easy for a consumer to understand what is the quality of what I'm about to ingest, and Fujicate provides that type of service. And then ultimately to a service like Zipongo, which will mine your nutrition information based on what's on the platform on your behalf, and then make healthy recommendations. And so from a data perspective, as you think about the model, we constructed it so that we could aggregate across many, simplify, and present it back to the user. And it's all opt-in. The consumer is completely in charge. It's OAuth based. You explicitly permit which applications have access to your data and which don't. And the model is one of tying it all to identity. And so we have two different approaches. One where we have a CarePath Sync API where applications integrate with us, and it's bidirectional in nature, so you can contribute data to the platform and also pull data from the platform. And then we also do direct integrations with other companies so that we pull that information on behalf of the user. And then ultimately, each profile has several different endpoints as we try and define and normalize the data across each of these categories. And so, as you see, the experience has been very focused on wellness, fitness, nutrition, sleep. We do intend to expand into areas like medication adherence, because the ultimate goal is trying to get a picture of your whole health as you define it. So these are just visuals of the experience. I invite you to check it out at carepass.com. The new mobile app will be coming out next week at the tail end of the week. So by all means, please experience it and send all feedback our way. And the last thing I'll mention is from a member perspective, as I highlighted earlier, it allows you to import personal health record information, which is voluntary, and also allows you to share that information with other applications. And so what we did to simplify the member experience is make it single sign-on from the administrative portal. So your user account that you go to what we call Navigator to check is your doctor in your network, et cetera, that now can be your CarePass account. And as part of that journey, you get to import elements of your personal health record. It's not the full record. And then we highlight some of our partner applications on the portal as well. So that's a brief overview of CarePass. Definitely look forward to your questions. Thank you.
Okay, we'll take a question now.
What aspect of the personal health record do you allow and what do you not allow?
Sure. It's really meant to be focused on medications, conditions, and lab values. So as part of the process, the minute you opt into CarePass, we pull your identity and insurance information. The part that is an additional opt-in, basically, is would you like your medication lab value, condition data to come in? And the hypothesis is that for our partners, ultimately, while there's a strong interest in the platform because of the potential distribution, when you think about the 44 million lives that Aetna touches, it's really also in the value of that additional data that they could pull and use to customize their experience. So if I'm a nutrition application trying to give you the right guidance, knowing that you are pre-diabetic, knowing that you are managing hypertension, et cetera, which is all part of the personal health record, is the information that ultimately really gets our partners very excited down the road.
You're not allowing the patient to go back to their primary that they might have had 2 years ago, pull all that record and upload it into EHR?
No, it's not exhaustive. It's not the full history. It's meant to be those specific data types that I mentioned. It doesn't pull vaccine history, et cetera. It's really predefined. Now we can expand that, but this is our first step.
Okay, we're going to have the next presentation, Anmol from Ginger.io.
Thanks.
Thank you, Dan. Of course. Okay.
Awesome. Thank you for having me. It's great to be here, part of this panel, and also some amazing people out in the audience, and been meeting a lot of old friends today. So my name's Anmol. I'm a computer scientist by training. I'm the co-founder at Ginger.io. And so we're sort of interested in sort of a behavior change and engagement panel because we're not really the world's experts in either. But what we do is we collect new classes of data that actually change the way people might think about the connection with either their provider or perhaps even their care network. And so that might just give you some food for thought on how some of this is going to evolve as you go ahead in the future. Quick history about Ginger.io. So we're a spin-off of the Media Lab here in Boston, in Cambridge. And the work is based on, the company is based on the work we did while at MIT, and today we're a commercial platform that's deployed with a number of institutions. And so it's been an interesting journey for me personally to go from a small research project to now something that's actually a real company. And so there's a big change going on in the healthcare system, and you've probably heard this all day long, which is there's a movement towards actually managing patient populations outside the clinic, which perhaps in some ways didn't exist before. And we heard a lot about this in the panel with Charlie Baker and some of the other folks. And what we're seeing out in the real world is we have institutions, hospital systems, payer providers, where they have thousands of patients in their system, and the big incentive for them is trying to figure out which of their chronic patients need help that day or that week, because that source of data never existed before. Traditionally, people relied on things like surveys and self-reported information, but there's an explosion in data, there's an explosion in sensors, and so now you can actually answer this question using a variety of different technologies. And so what we do at Ginger.io is we essentially work with passive data that already exists on your mobile phone. So everybody's carrying one of these, and they're an incredible diary of your life. They have location sensors, calling, texting, accelerometers. You can tell when a person unlocks their device at 3 a.m. And so we work with all of that passive data with the user's permission, and we build models of how they behave, and then try to predict the days when then they're likely to be symptomatic with their chronic condition. All the data that we collect is passively collected. So essentially, you install the application, you start it only once. You don't have to start it again if you don't want to. So it's really low effort from the user's perspective. And this is what the kinds of features that we extract. And so an example here is what early onset depression looks like. There's a regular day, which is in blue, and there's a symptomatic day, which is in orange. And I've got two features here. So one is a communication-based feature, and the other is a movement-based feature. But you see statistically significant changes in a person's behavior between the sort of regular day and symptomatic day. And you can build classifiers, machine learning classifiers, that are very similar to how Google and Facebook send people ads that essentially work on hundreds or thousands of these features and try to predict when a person's likely to be symptomatic. You can customize that based on demographic information. You can customize that for the individual, depending on how much data you have for that individual. And so there's a number of different ways in which you can understand how people are doing using this class of data. We have several publications about this, and some of this is on our website. And here's what the entire infrastructure looks like today. So we have our mobile app that your doctor or your nurse invites you onto the system and says, hey, can you install this app so we can stay in touch, and I have data about how you're doing when you're outside the clinic. The system collects these different features. It extracts, it computes what we call a health status, which is essentially a score, the check engine like that says something unusual is going on with this person. And then you can export that in many different ways. You can send that back to the patient and their family members. You can send that back to the nurse or the doctor's office, and they can give the person a call. And there's many different mechanisms in acting on that data. And as I mentioned earlier, as a patient, you only start the app once, and so there's very low effort in terms of interacting with the app. However, if you do want to engage with the platform, there's things like notifications, so your doctor can ask you to answer surveys or questions. There's health tips or pointers that they might want to send you. These could be automated based on how you're behaving. There's insights based on your data that we can generate and give back to you if you're interested in understanding what's going on day to day in your life. And this is an example of what the interface looks like for the nurse or the doctor's office. So you have your list of patients, and then you have information about essentially their health, so their health status, and that's the column which has the red and the greens. And you can go off and quickly scan through that list and figure out who do we think is behaving in an unusual manner, perhaps symptomatic. You can act on that information. It's really easy to invite patients. So you just click invite, you enter the email address, we figure out if they have iOS or Android or whatever devices they have, and we work through all the different issues. A big part of this whole process is understanding privacy and security. So from a provider perspective, obviously there's things like HIPAA and regulations around personal health information that you have to think about. But I think the bigger discussion really is on the patient side, especially because these are all new classes of data. And it's important that companies have a very clear philosophy about who owns the data and how this data is controlled by the patient, and making sure that patients actually get direct value from this information from day one. The company is, we've been fortunate. We have a number of awards and press mentions and things like that. I think at last count we had about $500,000 in prize money. And then we've also been backed by some great investors and an amazing team. And a couple of things that are interesting about our team is, so most of our company is people from computer science and software and consumer software. Very few folks from sort of health IT traditionally, but a lot of people on the clinical side and business side who have a healthcare background. Cool. So that's all I have about Ginger.io. Thank you.
Any quick questions while we transition? Is that a yes or no?
Hi, my name is my mic on? There we go. My name is Bruce Springer. I'm the CEO of One Health, and it's a privilege to be here with this distinguished panel. It's my first time actually at StrataRx, so I've enjoyed the conference so far, and it's been a great learning experience for me as well. Just a little background on One Health Solutions. You may know the company actually as One Recovery. The company was started by a founder who was a former substance abuse addict, walked out of his recovery clinic after 30 days and said, what do I do now? I go back to my family life, I go back to my office where my triggers are, I can't drive to AA meetings 24 hours a day. So he came up with the idea of how do you leverage social media to create a peer network of folks just like you that can intervene and support you 24/7 via any device that you're on. And then how to make it meaningful, how do you bring in the clinical tools, the clinical principles that have evidence-based to show that if you do these activities and you work on these programs, we can actually deliver an outcome on the other side. And then how do you incent folks to do that by using gaming and other things? The company started in substance abuse, ran pilots with various treatment centers, including Betty Ford, has over 30 treatment centers that are referrers to the platform, but then also started working with health plans such as Aetna and others, and actually went out and did a study of very high acute patient population in substance abuse that had been relapsed twice in 1 year, so they had been in a 30-day residential treatment center twice in a 12-month period, put us in as, were referred to us as one solution, and went into the care management of another, of the traditional care management program. Looked at 30, 60, 90, 180-day outcomes, and then 12 months after the end, ran a claims run out to determine the impact on the medical savings. As a result, that health plan credited the company with 58% reduction in readmission rates and $1.4 million in savings, or $9,000 per patient, just for substance abuse in a cohort of only 152 members. The impetus for that, or the results from that program, gave the company the impetus to expand and look at broader behavioral-related health issues that are comorbid with each other, and then look at the high-impacting medical conditions that have comorbidity with those behavioral conditions to try and figure out, could we bend that cost curve even more significantly by providing a greater value and greater support. The product now handles obesity, cancer, and other things, and it moved from just a pure tech solution to a technology as a services model. And at the same time, when you look at traditional disease management or care management, they look at the condition that you're prescribed to. We look at the whole person. So what are all the issues that are affecting you? Where are you willing to make a change in your life that will lead to hopefully better outcomes across all of the different conditions you have? Our general members are living in on average of about 4.3 of our communities, so that they have comorbidities, they have other issues, and you can't just force people to say, start in this program at stage 1 and work your way through. We let them start where they want to start, where they're willing to make a difference, and then we coach them and push them through that process. So we really look at the holistic nature of the business. Just a snapshot of who our customers are. We work with health plans, as well as employers, as well as providers. We work with behavioral health plans as well as medical plans, also Medicaid populations. We're doing 3 states right now with Medicaid to manage those populations. We also are carve out into employers. We sit right between where wellness and care management live as a way to take on the high-cost populations and then try and drive them to an outcome. And we've now moved directly into the large acute care setting around the providers. We announced Boston Medical Center here in Boston, Memorial Hermann in Texas, a large health group. So how do we do this and what do we do? It starts with the patient outreach. So we're not a direct-to-consumer market. We're a B2B2C business. So the referrals are coming to us from the varied organizations that we partner with. So that could come out of the EMR data or other information that stratifies the population and says, this is the population that I want to manage. It could be a referral from your physician, your provider, clinician, your care manager. And in the case of employers, we actually do marketing to reach out to these members because they can't obviously identify who has what conditions within that environment. What we do is as we get that data and that referral, that allows us to capture initial information of who you are as a patient. So you're being referred by a substance abuse counselor. We know you have some form of substance abuse, which allows us to recommend the right solutions for you and drive you through a dynamic process, through a dynamic registration process. Once you land, what we do is now have a behavior change platform for you that integrates the best of social technology, clinical tools, and programs around game mechanics. And the way we do it is you opt into what you want to do. You sign a terms of service. This is a moderated platform. It's not a willy-nilly Facebook where anybody can see. Our users are anonymous, so they can do what they want to do, how they want to do it, without being known to the community. Although we have a HIPAA backend that's HIPAA compliant, where we track all the clinical data source and everything that they do on the site and can correlate that back to their individual patient ID. When you talk about earlier, and all about the physicians are trying to figure out of the 300, what are the 30 that they wanted to intervene with today, we look at it as bring the entire population. Because we don't have call centers with staffing $100,000 nurses. We leverage your network and the peer network, people that are like you, that have been through it or are going through those same issues. And then we overlay on that community host, folks that have achieved results in behavior change with that specific chronic condition. We run expert discussions and series and topics to those members so that they can actually understand and get help from physicians and others. But it could also be connected into the provider. It can be connected to the care manager. So they can actually intervene on our platform. But at the end of the day, they're going to interact with who they want to interact with. Some want coaches, some don't. Some want care managers interaction, some don't. But they need a place to go to work on the things that are going to help them improve their life. We call it active patient data collection, and that comes from a lot of different places, and it drives our system. So when you log in or you come on board, we motivationally interview you through our onboarding process to find out what motivates you. Why are you here? What are you here for? We've also collected data from the referring source, so we know you have some set of issues that you're here to work with already. We take that information and start to build a profile of who you are so we can then deliver you back the appropriate content, resources, and things that you need. But what you do, you may say, I have this issue, but you're over in our depression community reading articles. So you may not willing to say that I have that shame-based disease, but you may be clinically depressed and you're needing to get help. So we watch all the data interaction, what you do on the site, so that we can then help you and coach you to get to where you need to make a change in your life, where you're willing to make a change. We also intervene. We have a patented process called emotional indexing that we patented with Stanford University we filed the initial patent in 2008. So basically it allows us to, when you check in every day, and we get 97% utilization of that check-in, you can opt out of it, but our members check in, they tell us they're craving, they're in pain, they're hungry. What is it that's really emotionally driving them? And then we take that index and connect it to the communities and the issues they have. And if those emotions or those feelings are connected to a potential bad behavior that could lead to a bad outcome, the network gets notified. That could be your friends, your sponsors, your caregiver. It could be the various folks that are in it. And by the way, this is both caregiver and it is for the members. So we provide both of those different services. That intervention could also be your physician or your care manager if you allow that to happen on the platform. We integrate with programs, so there's a stress program, an anxiety program, a diabetes program, but you don't have to start at phase 1. You can start anywhere you want, autonomously and asynchronously on the platform to be able to achieve those goals. Your communities you join. If you came in because we did a program for smoking cessation with an employer, none of our members, I shouldn't say none, 10% of the members actually went into the smoking cessation community. They all went to depression, stress, anxiety. That's actually the root cause of the problem. So if you don't really help them with managing stress and anxiety, how are you really going to actually make an impact on the smoking side? So the members will tell you what's bothering them or what they need support with. And then who are they connecting with in the social graph? We take all your experiences and what you do, and we find the most relevant people that can help you on your specific journey and try and connect you to those folks as you move forward. And then from that data utilization, obviously there's a feedback loop. So based on that patient, they're sharing and they're actively providing data. It's all user-generated content. We are not forcing them or asking for anything from them. They're participating at will. We allow them to then, that creates a dashboard for them of their experiences and where they are against achieving their behaviors. And any interaction on the platform, anything they do, somebody mentioned earlier, I don't want to like something or dislike something. We call it relating. So you can say, I like that. I felt like that too. I want to share with you. I would like to connect with you. So ability for folks to reach out and support each other in relating to each other and providing that feedback loop. Then that information obviously can be aggregated at a population level and provided back to our customers. We can actually go down to the member level and the member ID level if there's an ability to do so, and the member has signed a terms of service for doing that. And obviously all of that comes back into our process to provide a full feedback loop. Last thing I'll show, and then I'll get out of the way. Programs that matter to our members. We went back in February and we tracked all the folks that emotionally checked in on our index to see if there were any patterns in it. And what we found is that of the members, 32% had checked in tired frequently. So we then, off our platform, surveyed those members and said, if you had to rate that sleep in a 4 or 5 question survey, would it be detrimental to you or not? If you rated a 4 to 6, you were obviously seen as somebody that had sleep issues, and sleep is now connected to diabetes, or now connected to depression, weight management, other different issues. We found that 62 or 65% of our members were having significant sleep issues. So within 30 days, we ran a sleep series. We invited all of our members who are having tired and sleep issues in, and we ran a service for them to support the sleep. So we're constantly using data to add better services, better products, better features to support our members. And I'll get out of the way so we can start with questions.
Okay, are we ready for questions? Who has the first question? Is it going to have to be me? Okay, I'll start with my first question. It's about privacy. These 3 companies are all trying to put the patient at the center. And from my days as a clinical dentist, that can be challenging. These are new tools. So I would like, who wants to start and talk? Anmol, would you like to elaborate on your thoughts on privacy first, and then we'll hear from the other panelists?
Sure. Is this one's working?
I think so.
Okay, great. So I think there's a few dimensions to privacy. So there's the sort of engineering, HIPAA, regulatory sort of perspective, and I think that one's actually fairly straightforward and it's very well understood. I think the harder challenge around privacy, at least for companies like us, is we're collecting new classes of data that are traditionally not considered healthcare data. And so how do you come up with the right framework for who has access to that information, who controls access to that information? And so I think it's important for companies to set the stance, because it's not really very well understood even by the FDA or other agencies. And so our stance has typically been, which is, it's sort of, patients should have control over their own data, and so you can decide if and when it's shared with either with your provider or with your family member or your caregiver. And also you should have direct value coming back from the information we're collecting. And so things like insights or other feedback that we provide. So I think that it's important for companies to understand that and realize that, because philosophically I think the entire ecosystem is still coming around to that idea.
Dan?
Yeah, I would add, from our perspective, the privacy issue is more around, the question is typically, why would I want to share this type of information with an insurance entity? And it's really, being very transparent and being very upfront about the user having complete control around who sees their information. They trust us with, from a privacy perspective, with health data. If you ask consumers, there are no concerns with that. It's more about the intersection of the data and making sure they understand that without medical underwriting goes away as part of ACA. And so it's a new definition of privacy for us when it comes to health data.
Privacy is the utmost importance on our platform in that if people don't feel like this is a safe place that they can go to do their work and connect with folks, they're not going to use the system. So we do moderate the platform. So if we have terms of service, so if anybody's breaking the rules, we take them off. We warn them and take them off. One, the user has full access to the privacy in their profile settings. They can decide who. They can share with nobody on the platform and just come and use the platform, or they can share whatever they want. Anytime, if they can upload their photo. When they upload their photo, we say, are you sure you want to do that? That's going to make you non-anonymous on the platform anymore. So we give warnings, we give suggestions to keep people to understand that if they do these things, what that impact is. And then obviously the third is HIPAA compliant. And so we separate on the social front end. There is no health data that's shared. It's all consumer generated content on the social side. We have a clinical data store that is secure on the back end that allows us to connect that anonymous user to their data, but there is none of that data actually shared on the platform itself. But yeah, privacy is the utmost importance.
Questions? We have one in the front. Wait, when's bringing a microphone?
Hello? Okay, hi. Thank you to the panel. And I was wondering how you think about measuring the success of your own platforms and what sort of feedback loop you use to refactor the product to make it better.
Our success, since we're a B2B model, is how are we making an impact for our customers? And our customers are predominantly using us to reduce cost. So we are not in control of the claims data to be able to say, okay, we've impacted that. So we have to work with our partners to figure out what are the metrics for success, what are they looking for. In terms of where we go in as a DM or wellness solution, either replacement or adjunct, they look at us a lot of times just in basic engagement, because they're saying a phone call and a mailer doesn't drive engagement. Can you get these members to actually register, use it, stay on it, and stay active? What are they doing? How are they doing it? To show that and prove that we can actually get these chronic folks to engage in their various conditions and condition management.
I think there's two parts to what you just asked. So there's metrics and things like that you build into apps and dashboards and so on, and those are all very well understood in quantitative marketing, and I won't spend any time on that. But I think the bigger question there is, what's the validation? And I think this was asked in some of the previous sessions as well. What's the validation for that some of these approaches are working and can actually have an impact? And for companies like us, I think there's 3 tiers of validation. So the first one is just acceptability, feasibility. Is can your doctors use this? Can your patients use this? Can your nurses use this? Do you fit into the workflow? And as a company, we've spent a lot of time on that. The second tier for us is, are you identifying symptomatic case correctly or identifying events correctly? And there's biases there in terms of, are you optimizing for precision or recall, or what kind of statistical measure do you care about? It's a function of the cost of interventions and so on. And then the third tier, which I think is a sort of longest term one, just because of all the dependencies on clinical outcome data and readmissions and all of that, is the one where do you actually have an impact on costs? And sometimes you can make an argument for that by indirectly saying you have engagement, and it's very well understood engagement leads to people better sort of staying compliant on their meds or being more engaged in tracking their health and eating healthier or doing the things that they're supposed to, and that translates into cost, so you can make that indirectly. But to make that's just a longer term process. It's usually a multi-year process. I'm sure these guys have very clear understandings of how they like to do it.
Yeah, I would say success has many answers and many fathers when it comes to care paths because of the partner approach. But I think from an Aetna perspective, one, success is reorienting the brand so that there's positive consumer affinity, and doing things like this so that it's free for a consumer to use, free to engage, whether they have Aetna or not. There's no necessary tie to the PHR. It's really an option for you. And so success is on the marketing side for Aetna, the consumer angle and really helping folks engage in their health, whether the cost benefits associated to that Anmol was talking about flow back to Aetna or not, we all win. And so it's really focused on getting folks to engage in their health based on all the underlying tools that CarePass works with, knowing that if you're on a weight loss journey and have social engagement, you're 3 times as likely to be successful. Knowing that if you start tracking activity, you're 26% more likely to be active, things like that, and just getting it in front of the user in the right way.
Another question? In the front. Thank you, Wen.
This question is for Bruce. Can you please talk to me a little bit about patient feedback when you say real time? What exactly is that?
Real-time patient feedback?
Mm-hmm.
So when our members come on the site, they may interact a lot like a Facebook and with various properties on the site. So whether it's a program that they're engaged in or they're posting comments about how they're feeling, they're writing their story, immediately there's members jumping in and supporting them, giving them feedback, and helping them with their journey as they're on the site.
I see. Thank you.
More questions? Okay, I have a quick one for Dan. Aetna was clearly the first mover for an insurance company. Do you see other insurance companies following suit, or what do you expect will happen next from an insurance perspective?
I think that insurers are realizing that the insurance business is dead in terms of the way it's been constructed over the past couple decades. And so realizing that there's a macro shock to the system, how is everyone going to react? And so you see different insurance companies taking different approaches about making the information accessible for users. There's several of the carriers have released their own APIs. I haven't come across a insurance carrier that is taking the same kind of platform partner approach, but everyone realizes that they have to do things that are more consumer oriented. And the first step of that is really providing the users data where they want, and so giving them that flexibility.
Questions?
I had a follow-on question to that one, actually.
Please.
And so, I mean, the Aetna strategy is interesting, right? Where it's an insurer that's going into this, in some ways similar to Kaiser and other people. But what do you think of the new breed of insurance companies, things like Oscar?
So there's not a lot of public information around things like Oscar,
yeah.
But I think now is the time for new entrants and for some disintermediation in the business. It's been a wholesale business that hasn't had to deal with things like foreign competition. And so I think you'll see a lot of new change. I can't begin to prescribe what the change is going to be, but I think it's exciting. And the reason that Aetna is making the investment in things like CarePass, things like a new company division called Healthogen that's focused around serving providers and consumers beyond the insurance business is, to your point, you realize because of this massive change to the system with ACA and the shared risk models that will ultimately take root, whether it's accountable care or patient medical home, that is going to change the system both on the insurance side and also on the provider side. So I think it's ripe for new entrants to really make an impact.
I've been told we're out of time, but I want to thank our wonderful panelists being pioneers in the space, Aetna CarePass, Ginger.io, and One Health.